nurse for the day. I'm going to be evaluating you just because you just had your catheter put in. I was just seeing how you're doing. So I'm just going to wash my hands before I start.
Wash his hands.
Alright, and I'm just going to write my name on the board here. That way you know my name for a future reference. Okay. And can you say your first and last name for me, please?
My name is MZ.
Okay, and your date of birth?
March 22nd, 2002.
Do you have any allergies to anything?
Actually allergic to penicillin.
Oh, okay. I'll make sure not to give you any then. Okay, so no latex at all.
No, other than penicillin, I'm good.
Okay, so just gonna evaluate your room. Make sure your bed is in the lowest position, and I'm gonna just bump your bed to make sure that it's locked. Okay. Okay. And your side rails are up. Before we begin, is there anything that you need any assistance with, like maybe getting a cup of water, or do you need like help sitting up in your bed, maybe?
No, I'm good.
Okay, well, I'm going to lay down a paper towel, and I'm going to put my items down. Okay, so then I'm going to just raise the bed back up. And I'm going to be taking your vital signs. So, here's a thermometer. Okay. So I just need you to open, and then I'm going to be putting this underneath your tongue. If you could just hold this without biting down on it. Okay, and while I'm doing that, I can go ahead and do your pulse ox. I'm going to use your index finger. Okay. Alright, so I have your temperature and your pulse ox. And now I'm going to be doing I'm going to be doing your pulse. And ma'am, I'm just reminding you, I did clean my equipment right outside the door before I came in here. Okay. And okay. I just performed the pulse, by the way. That was the pulse I just did. Okay. And then I'm going to be doing your blood pressure. I have a couple questions to ask you. Have you had any accidents in your arms?
No.
Have you had any breast or chest surgery?
No.
Okay. Get the circulation in your arms here. I'm also looking for any dialysis. I'm looking for any edema. Okay, so I'm going to be using your right arm here. Do you have any pain?
Yes, in this area.
Oh, you mean like near where your stomach is?
Yes.
A little like below your stomach, is that what you're telling me?
Yes.
Okay. And how would you rate that pain on a scale of 0 to 10? 0 being no pain at all whatsoever, 10 being the most excruciating pain you've ever experienced.
I'd say about a 4.
Okay, say it's a 4. And when would you say that this started?
Probably like 4 days ago.
Yeah. Okay. Does it come and go, or is it consistent?
It comes and goes.
And how would you describe the pain? Maybe sharp, dull, stabbing.
I would
Running.
say dull.
Dull. Okay. And what aggravates your pain? What makes it worse?
Sudden movements like sitting forward or anything like that.
And what makes it feel better? Like what relieves it?
Just finding comfortable position.
Oh, okay. And then are you treating it with anything?
No.
Okay. Alright. So, I'll check in more on that later. I'll be looking more at your abdomen then. Maybe looking at your lines. So, I'll look at your nasal cannula. Just making sure that there's no redness underneath your nose, or that your cheeks aren't red, or your ears aren't red. And then it's nice and snug underneath. So, your nasal cannula, it is 1.5 liters, and yeah. Okay. And then you have an IV. It's in your left arm, your left hand here. So I'm making sure that it's clean, dry, and intact. Okay. And then, do you have any pain at all near where your IV is?
No.
Okay. And I'm also looking for redness, swelling, warmth. Okay. So you have a 22 in, and your solution is. Well, first of all, I'm making sure there's no kinks in this, so it's a continuous line that isn't clamped. And it's normal saline. It's within date, like it's not expired. You have 100 milliliters left in the bag, and it's clear, it's not cloudy, and it's the right solution. Okay, and the rate is 75 milliliters an hour, so that's good. Okay, and then also, can I see, like, if you have a telly? It doesn't look like you do, but I was just making sure, because there's a lot of people that have telly monitors. And then you have your Foley here. I'm just gonna expose this a little bit. So you have your Foley. It's attached. It's secured on your right thigh here. It's a 16 French. It's got a little slack to it, making sure that the line isn't kinked. You have a little bit of urine in the tubing. It's yellow. And in the bag here, you have 100 milliliters of yellow, cloudy urine. Okay. Gotcha. Okay. And that's it. Let me go ahead and change my gloves. Changing my gloves. Okay. And now I'm going to be doing the next part. I just have a couple questions for you. I've already asked you what your first and last name is. What is today's date?
April 7th, 2020.
Okay, and where are you right now?
I'm at the hospital, Advent Health.
Yes. Okay. Can you look at the tip of my nose for me? This is going to be measuring your pupil. And then can you continue looking at the tip of my nose and just pressing the light? Okay. You respond within 3 seconds. Can you smile for me, please?
Smile.
Can you stick out your tongue for me, please? Alright, so your oral mucosa, or your mouth, it's pink and moist, so you're not dehydrated. Do you have any difficulty swallowing?
No.
Okay, I'm just going to pinch your skin here, check your skin turgor, and it went back within 3 seconds. Okay, and now I'm just going to be listening to your lung sounds. So when I put my stethoscope down, I just need you to breathe in and out for me, okay? In and out. In and out. In and out. In and out. Okay. Okay. And then, so you said it kind of hurts to lean forward. That's okay. I think we might have to skip on doing the back because it's gonna be difficult for you to lean forward. But that's okay. Have you been coughing lately?
No.
Okay. Alright, so now I'm going to be looking at your abdomen here. It is a little distended, I noticed. So that might be why you're having the suprapubic pain. I'm just going to be listening now. And you said it's in this area. Just okay. Since you've already said that you had pain in that area, I'm not going to be palpating too much there. But in the other areas, I will be palpating. You just let me know if you have any pain in the other areas that I touch. Any pain in here?
No.
Any pain in here?
No.
Alright. When was the last time you had a bowel movement?
Earlier today.
Okay. And then what was the amount? Was it a small amount, a large amount, a normal amount for you?
It was more than usual.
What was the color?
It's like a cloudy yellow.
And the consistency? Was it soft? Was it soft? Firm? Was it solid? Was it mushy?
It was watery and like mushy.
When was the last time you passed gas?
Earlier today, but I'm not sure like when.
Okay, that's fine. Alright, can you squeeze my fingers for me?
Squeeze.
Okay, and then can you push up on my hands?
Push up.
Can you push down on my hands?
Push down.
Can you wiggle your fingers for me?
Wiggle.
Okay, and then I'm just looking at your hands to compare the color. I just did capillary refill, and they refilled within 3 seconds. And the pulse, and now I'm just checking both hands for warmth. They're both warm to the touch. And I'm going to be doing the same thing with your legs. I'm doing the same thing with your legs. Can you push up on my hands?
Push up.
Can you push down on my hands?
Push down.
Can you push down on my hands?
Push up. I mean down, sorry.
Okay, can you wiggle your toes for me?
Wiggle.
And making sure that they're the same color. A capillary refill so that it should refill within 3 seconds. And do the pulse. And then the temperature, making sure that it's warm to the touch. There's no edema. And then the heels are intact. Okay. I'm gonna change my gloves. Do you have any pain or tingling? I mean, do you have any numbness or tingling anywhere in your body at all?
No.
Okay. Alright. So I do have a couple questions for you regarding your urinating lately. I forgot to ask these earlier. But have you had any difficulty urinating?
For the past, 4 days, I wasn't able to pee.
Oh, okay. Gotcha. Okay. So, was it a small amount or just you weren't able to at all?
I wasn't able to at all.
Have you had a history of UTIs, urinary tract infections?
Yes.
Okay. So, did you experience any burning with urinating?
Yes.
Have you had frequency? Frequency is having having to pee a lot.
Yes.
But kind of like the feeling to pee, but as you said, you didn't really. So.
Yes, I did.
Okay. And then, have you had blood in your urine?
No, I have not.
Have you had sediment in your urine?
No.
Oh, well, do you understand what I meant by sediment?
Not really.
Okay,
But
okay. So, sediment, that's when you have, little particles in your urine. That's, a little more solid, almost like little pebbles. Not quite pebbles, but, particles in your urine. Have you had that, before?
no.
Okay. Have you had, urine with an odor? A strong odor?
Yes, it's had a smell to it.
Have you had any history of kidney disorders or any renal issues?
No.
And then your genital health, have you had any issues with your genital health?
No,
just
I
in
haven't.
general?
No.
Okay. But you have had a history of UTIs?
Yes.
Okay. And then, do you urinate a lot at night?
No, not really.
And do you have difficulty emptying your bladder completely when you do pee?
Sometimes.
Yeah. Okay. Do you have any questions at all regarding your sexual health?
No.
With regards to UTIs or anything? Any questions?
No.
Okay. Well, just seeing how you're doing with the catheter, was pretty well. That I just put that in 2 hours ago, that you already have 100 milliliters, so that's really good. Since that's quite a bit, I'm gonna actually empty that in a little bit once I leave here. I'm gonna come back in a little bit and empty that for you. So, I'm just making sure that I'm gonna just put the bed back in the lowest position, make sure that it's locked and your side rails are up. I'm gonna check around the room, make sure that it's clean. Do you need any assistance with anything else?
No, I'm good.
Did you need any repositioning in bed, or some water, or
No, I'm
more
fine.
blankets, anything?
I'm fine.
Okay. So I am just going to I'm gonna give you your call bell. It's right here. And you just press this button on here and I will come running. Other than that, I'll be here every hour to check on you and visit you. Okay, so I'm going to put that right next to you. I'm going to make sure that your table is right here next to you. So that's your, make sure I put your cup closer to you right there. Okay, so, alright. You don't need any help with anything else? You sure?
No, I'm fine.
Okay, so took off my gloves. I'm going to wash my hands. Thank you for allowing me to participate in your care today. And before I leave, do you want me to close your door or leave it open?
It doesn't matter.
No? Okay. Alright.